Hey, my name is Natasha Gladbach. I am the director of the JCMG Ambulatory Surgery Center and in Jefferson City, Missouri. And I've been with JCMG almost 25 years, and I've got to build from a smaller ASC into a larger ASC, and been able to be a part of building a new building as well as implementing from paper, implementing HST. So a lot of big projects. Jefferson City Medical Group, we're actually getting ready to celebrate our 30-year anniversary. We have a ribbon cutting ceremony today. So 30 years in the Jefferson City, Missouri, and it is a multi-specialty. It is physician-owned, and we have everything from women, children's, oncology, family medicine, internal medicine, radiology lab. We have infusion center. We have several outlying clinics. As far as the surgery center goes, multiple specialties: general surgery, ENT, GYN, a lot of ortho, GI, and podiatry, and hand surgeon, and plastic surgery as well. We started with HST in April of 2022. That was when we moved into our new building. In order to move from the old into the new, we went from paper to electronic. We started out with the PM system and implemented the e-chart. We've also since then added case coordination and clarity, and getting ready to, and simple admit, the whole texting, everything. So yeah, we several HST products, and looking forward to the future and the upcoming products that HST is going to offer as well. So, working from paper and trying to just do things as far as like scheduling, running reports was huge for me. So just trying to do simple reports such as turnover times and the clinical reports, but also the financial reports, state reporting, looking for anything to just improve those processes. So we concentrated more on the financial and the reporting with the financial and the state reports, since those seem to be the most difficult. So we were really picky with those when we were looking at different electronic records. And we had boiled it down to a couple, and we just kind of went off of majority throughout the United States and what other ambulatory surgery centers were using, and talking with other ASCs and getting their feedback, and talking with at conferences, ASCA and different conferences, Becker's, and meeting with different people, and boiled it down to a couple. And then after that, the battle was on, and it was who could give us the best quality with the best rates. Of course, going from paper to electronic, it was a lot of, it was very time consuming, making charts, handling of charts. After you're done with the chart, breaking the charts down, scanning the charts in, just very time consuming. So looking back at it now, just the time that we have saved by going electronic is, I wish I had exact numbers, but it's almost immeasurable. The look of it, of course, is nice, easy, very user-friendly. Part of the decision was made from the financial side as far as the billing and coding goes. They had a big say in choosing HST. I belong to a group called Surgical Management Professionals, S&P, and they oversee several ASCs, and some of the other ASCs in that group use HST, and so that kind of helped as well, kind of push along and choose HST. Some of them were not really excited about something totally different. It's a different software than what they use in the clinics. It's different from the hospital. So when you're telling them that they have to learn another software, they were not real excited about it. But in the end, I think they realized how easy it is, and once they got over that initial hump, first month or so, then they were fine. You give them some choices of their own as far as how they do their orders and op notes, and some of them still use Dragon, so that's helpful. So yeah, they haven't complained at all in the last year. So working together with the coding team and working out different ways that's best for them, as far as scanning invoices in, where to find the information they need to get the right information in there to begin with, when scheduling, just all those little steps to make sure that all the information is in there to make it a smooth process from beginning to end. Once we figured out the best steps and best way to get the information in there, then yeah, it's definitely improved a lot of processes. For me as a director, it's the reports. I love the reports. If I want to look up anything specific, I can easily find the report, run it, get the information I need, and have it within a snap. If preparing for board meetings, before it was difficult doing all the data manually, and now I can run reports and get that data so much easier. The state reporting is huge. It's so easy now. So that is what I love. When I talk to nurses, they love the ease of it. We have touch screens. And so it's literally just, the touch screen, boom, 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 go through. The ease of the patient care, you don't feel like you're staring at the computer the whole time when you're taking care of your patient because the charting is so easy. They can fine tune it to specifics for each specialty. So because they can get in there and change themselves and update themselves, for example, like the discharge instructions. It's very easy for the nurses to do that, so they can keep up with that. And so they print out the instructions and hand it to the patient, and out the door they go. So yeah, just very easy. Preparing the charts for the next day or even the next week, that has improved so much. We went from paper to electronic, so handling of the paper charts, making the paper charts prior was very time consuming. Now scheduling the chart is made, it's in there. The pre-admissions coordinator can touch that chart as soon as that patient's in the schedule. There is no waiting for the chart to be made, for someone to put a label on every page and where did that paper chart go? There is no more losing the paper charts. The physician, they've got their stack of charts that they need to sign off on. The handling of charts every day, that is no longer gone. There's a list of charts that the patients need to go back, or the surgeons need to go back. They need to double check their checking off on their pathology. It's all right there. So there is no extra handling and carrying of all those charts everywhere. So that alone has saved so much time throughout the day, because there were always those extra tasks that people had to do with making other paper charts and labeling them and putting the pathology results in. The signing up of the op notes once they were complete, that is no longer a thing. Everything is instant. Op notes are done immediately, path results put in, the queue goes to the physician's task list, they sign off on it, it falls off their task list. Very simple. So I myself have really been able to fine tune with case costing, looking at a lot of the new procedures that we have added in the last year and a half. We've been able to really fine tune and look at the case costing on those and the reimbursements. It is so easy to run the reports and see where we're at with reimbursements. I can run simple reports on. We can look at different insurances per CPT, and reimbursements. It has been a lifesaver for me. We have grown a lot in the last year and a half. We did 1,000 more cases in 1 year than we had prior. But when I can pull and look at staffing and the time spent, even though we've done more cases, our staff hours per case is not, we've kept that within within goals because we're not using all the paper charting. We're not spending so much time on paper because we're so smooth with the electronic. We've been able to fine tune all the staff hours needed to keep the place up and going. We're looking at more as far as the purchasing aspect of it, so that are some goals in the future. But able to look at the case costing per case and ordering all the different supplies options and used on each case. Every doctor could be different on the supplies that they use for the exact same surgery. And because we can fine tune those case costs and compare and show the physicians what they're doing different than their partners and the costs with each one, that has been huge. Absolutely. I even had an ASC come visit a few weeks ago just to kind of watch us in action with it, and everything that they were observing with their questions. I think they definitely saw the positive side of HST and what it can do for an ambulatory surgery center. And you know, it's not everything that you don't need everything that the hospital has. You don't need all the different screens, and to keep it easy, keep the flow easy, that increases our patient satisfaction, gets the patient in and out the door so much faster, and improves our patient care because we're paying attention to the patients, not the computers. So we had weekly meetings with our team, you know, building from the very beginning the preference cards, procedure codes, everything attached to those. HST was a big help. They did help quite a bit with putting in all the preference cards, because as you know, there's a lot of preference cards per surgeon. So HST was a big help with that. Looking back now, I would have some advice as far as putting in the procedures with each physician. We did a different procedure code for the same procedure for each doctor. I would have lumped all that together and did one knee scope, attached all the doctors to that one knee scope, and I think that would have saved us time on the back end. So that is one thing that looking back now, I probably would have changed. But otherwise, you know, we would have our task list, we'd have our list of things to do, and it was step-by-step process. And so, you know, you had your tasks that you had to get done before the next week, and it just moved along smoothly on your task list. So yeah, it was. It's like looking back, I'm surprised at how much we did in a short amount of time. Because it was a lot of work, but like I said, HST was a big help with all of it. So yeah, so most of the time was wonderful. I can email, I get an answer back. If I call, I know a lot of them by their first name, answer very quickly, very helpful, very knowledgeable. We've even done some video, jump on, help me out really quick. And so yeah, any question, I could just email HST support and usually get an answer the same day. I am looking forward to the case coordination with the aspect of patients being able to fill out their health history at home, anesthesia history, and pulling that into their chart. I think that will save our pre-admissions coordinator so much time. Right now, we can do the dose spot where we can pull in the patient's medications from the pharmacy side and verify that with the patient. That saves a lot of time. We're not having to type out every medication. But when they can start filling out their health history for us to verify, that will definitely save us a lot of time.